do you do bump contouring if I decide to do lipo in that area without leaving it flat? We take into account the preferences of the patient, of each patient, and we try to contour the gluteal area as much as possible within possible. Like sometimes the volume is huge and we reduce a lot of volume because of pain, or the patient asks us to remove a lot of volume on the sides, or sometimes in the middle. Sometimes the patient asks for a flat gluteal area. Some patients don't want it to be touched. So what we do is to try to adapt to the preference of each patient within possibilities. Like sometimes we need to remove a lot of volume to treat like the back pain and the gluteal area pain. Of course, the gluteal area is going to reduce a little bit in volume as well, of course. How will the liposuction be able to remove lipedema nodules in this non-regular fat? Okay, so what we do is we use pressurized saline solution to break up bigger nodules into very tiny nodules, and then aspirate this with very thin cannula. This is a very delicate process, and it provides like a very intensive, detailed result. What I feel is that the detail in lipedema surgery means all. So we try to like recheck and recheck and recheck so we can obtain the best possible result. It's true that some patients they bring a very hard fat, that's true, but sometimes because they didn't wear the compression properly. But even if the fat is hard, we with more water, more saline, pressurized saline solution, we help these cells to get loose from the surrounding tissue, and then we aspirate with this very thin cannula, that's gonna do that. That's gonna allow us to achieve like the best possible result. I believe that wall water jet assisted liposuction is the gold standard, or at least the best technique for lipedema patients. Is it possible to remove lipedema from hips and glutes areas within thigh surgery? Yes, we do it. We try to. Although we know that lipedema mostly affects legs, we need to try to obtain a result which looks like a unit. So it doesn't make sense to do the legs and don't touch the hips or the gluteal area. So we try to reach to the waist. Scared of full anesthesia surgery? Do you also work with local twilight anesthesia? In our opinion, full anesthesia is the safest for the patient because you have full control of the airway, everything is monitored, and for a common patient that doesn't have like previous heart conditions, strokes, or previous like severe pulmonary issues, is the safest techniques. My opinion, and first is safety, and also it's more comfortable for the patient. So the patient is not aware of the environment, of the movement of the cannula. So I would say that it doesn't make a lot of sense to do twilight anesthesia because it's less safe and it's less comfortable. Most of the patients that had previously twilight anesthesia, they don't want to hear about that again. So we don't use it. We could use it, but we feel that it's safer for our patients to do general anesthesia. Of course, it needs more infrastructure. I think like some clinics prefer to do it like twilight. It's a choice, but if you have the infrastructure of a hospital, in my opinion, it's better to do it with general anesthesia. Question is about side effects post-surgery. Alright, so after this kind of surgery, what the patient is gonna experience is a lot of weakness, tiredness for the first days. We remove a lot of volume, so when you remove a little bit of fat, that's fine, but in our opinion, if you want to obtain a very long-term result, you need to remove the big volumes of fat. So that's going to make that the patient's going to feel a little bit tired. Maybe she stands up, walks a little bit, go to the kitchen, to the toilet, I need to sit. So weakness is the main consequence, or let's say side effect of this surgery. It's especially intense the first 7 days, 10 days, I would say. Hematomas are very frequent, and we need to take a lot of care with the skin. We need to moisturize the skin a lot after the post-operative, during the post-operative period. How many nights do you offer after surgery in the hospital? Usually the patient needs one night of hospitalization. Some cases, especially if there's a lot of volume, may need another additional night, but it's not very common. So what we do is we see the patient the day after surgery, if she's been able to stand up, if she feels more comfortable, if she can walk, and she tells us if she feels that she thinks that she's okay to leave. We need to the patient needs to leave well from the physical point of view, but she needs to feel that to live confident that it's fine. So is it possible to stay an extra night? We can do it, but my advice is to check how the patient feels and then decide if another night is needed or not.